Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's talk about your newborn nursing, feeding, and latching. Now, this is a really hard thing to do. I've never been through it personally myself, but I've watched my wife wrestle with and struggle with some of these things. It is such an amazing, awesome process and something that's going to be really helpful for both you, mama, and baby. But it's really hard. Now, we're going to talk about how chiropractic plays a role in that. I do want to be upfront with this. Chiropractic does not replace lactation consultants or talking with your OB, but chiropractic is a part of that tool. And hopefully at the end of this video, you're going to understand why and how we help so much with that. Now, first, I want to give you a visual. I want you to take your tongue and put it to the roof of your mouth. And we feel that hard palate, the hard part of the top of your mouth. And then when you start to push your tongue backwards, you're going to feel it starts to get soft and you can kind of squish up there. That's called your soft palate. When a baby is nursing, they have to get a deep enough latch on the nipple that the nipple is all the way back at their soft palate. That's a long way. Now, their mouth is a little smaller than yours, so they don't have to go quite as far, but that still holds true. And in fact, when we grab our model and look at that, we can see from opening the mouth, they've got to come all the way past that to get that nipple back there to be able to get the full contents of that breast and get all of the nutrients they need. So to do that, babies need to be able to open their jaw appropriately. Yes, this jaw and the TMJ that so many of us as adults have troubles with as well is a super crucial joint for the babies because every time they open, that needs to be able to open the same on each side. It should be balanced. And so that's why one of the things we do with our new patient exams for newborns is we're going to palpate the jaw and their jaw motion to make sure that this joint is gliding appropriately. On top of that, we're then going to need to use all of those muscles around our jaw and our mouth to be able to create a good suction and suck goal. That's why your lactation consultant checks for things like lip ties in conjunction with tongue ties, because if our lips can't move appropriately, none of these muscles are going to be able to function well either. Now, this is an adult skull. Pediatric skulls look similar, but they're going to have things like soft spots. This is a big common spot to see one. And that's because these lines that are on the skull, on the adult skull, are where these bones grow together from newborns. They're separated so that when they're being born, your head can squish so you can get through the canal. And so as a baby, there's still going to be soft spots because they haven't grown together quite yet. But every one of these bones is moving and functioning. And they help with the basic pump of CSF, cerebrospinal fluid. So that pumping action from each of these bones is helpful for getting that circulation, but also then plays a big role once again within nursing and breastfeeding. So a big thing that we're going to do for our newborns who are struggling to latch or feed is we're going to check their cranial bones. We talked about that palate earlier, that hard palate. Theirs isn't fused together in the roof of their mouth like yours is yet. And so we could see a raised palate, either on one side or both sides. We could see a domed palate where it's arched way up high versus being pulled down. And those are all things that we're going to look for and try and find during that new patient exam to figure out why your baby is struggling to nurse so much. It's not you, mama. There are things that we can do to help out and serve that. On top of that, we're going to look for other imbalances. It's super common that moms will report things like, my baby nurses really, really well on the right side, but as soon as we switch to the left side, won't do it, right? It's a weak latch, they struggle. And so that's going to be beyond just the head and neck, or just the head, it's going to be down into the neck that we'll be looking as well. There are ways around this where you can switch your positions and go from, instead of the traditional hold on that side, switch to like a football hold on that side, and that gets you around it, but that doesn't fix the imbalance within your baby. That means that your baby is most likely having some issues within their C1, this top vertebra at the bottom of the skull, not allowing them to rotate the way they should. If left untreated, it can progress to things like torticollis or muscular imbalances, but in the short term, it's affecting your day-to-day life, something that you guys have to do so frequently that is good for both you and the baby. And so we really want to make sure that we have that good rotation within the neck so that you can see feeding happen on both sides. This is a fun one to treat because there's often times where we treat this, we'll step out and say, hey mom, go ahead and feed baby, I know they're hungry. We'll be back in a few minutes and you can update us. And we'll come back and they'll go, it's the best they fed on that side. It's such a great way and it's so easy and quick to see that we're on the right path. We just need to build off of it now. Once again, this journey's hard, but you got it. We're just one of the tools that can help get you through your goals and get you achieving the things that you want to do. So if you've got more questions on how chiropractic helps and influences latching and nursing and breastfeeding? Come on in, let's chat about it.